on Sunday, I will have the opportunity to review some of the key oral presentations that actually will be presented today. So this year I had the opportunity to serve as the track leader for hematological malignancies, mainly leukemia, MDS, and transplant. And ASCO, of course, selects the top ranking abstracts and then asks the leader of the track to basically summarize the 4 or 5 more relevant presentations. So that's what I will be doing tomorrow. Basically, the presentations that we will be covering go from more data on AG120, it's an IDH1 inhibitor. We're going to be presenting data on patients with myelodysplastic syndrome that receive therapy very early in the course of the disease. These are transfusion independent. There were data also on a large trial of Bosutinib versus a standard of care in chronic myelogenous leukemia. There's going to be a presentation also on further data on patients where the TKI for CML is stopped, in this case with Nilotinib. There were 2 or 3 presentations on CAR T cells, and then a final presentation actually incorporating NK cells or natural killer cells for patients with acute myelogenous leukemia. I picked 4 that I thought they were the most relevant for clinical practice, as ASCO is also a big meeting for practitioners. So the first one I'm going to review are the more mature results with AG120. This is very exciting oral compound that targets mutations on this gene called IDH1. And this data in refractory leukemia shows really significant response rate, excellent toxicity profile. And I think this will be a drug that will be of importance for our patients. The second poster I'm going to review is this concept of treating patients with early stage myelodysplastic syndrome that we define by patients that are transfusion independent. That is usually the trigger of therapy. And what the investigators show actually is that early treatment with low doses of hypomethylating agents is actually safe and may be actually quite active in this context. So this may be important because now we are developing oral compounds for this disease, and we may be in a situation where we could in a way kind of like even prevent the evolution of myelodysplastic syndrome. The next presentation that I'm going to review regards this issue of stopping TKI in CML. This is one of the number of presentations between us and ASCO in the last couple of years. I think this data is very important for clinical practice because the concept that is evolving is that indeed actually we can stop these TKIs in patients with CML that have deep responses. And of course, this has a very significant impact in terms of the cost of the treatment of this disease, and I think the well-being of the patients in general. So the data by Dr. Mahon from very large French study is actually very important, and it suggests actually that a group of patients with CML can undergo this issue of stopping therapy and maybe potentially cure from their disease. And then finally, I'm going to discuss this abstract on natural killer cells that are expanded. This is the novelty of this presentation in the context of haploidentical stem cell transplantation. It's a very small pilot trial, but the data is actually very encouraging, and this may be a new way to perform transplantations for patients with myeloid malignancies. I think this is actually very relevant for the ASCO community, and I'm going to be excited to present this.